And welcome to the Shatkin First Monday Morning Minute.
Good morning and welcome to the Monday Morning Minute. I'm Dr. Todd Shatkin here with my patient David, and David's got an interesting situation. He's had dentures for how long, Dave?
A couple of years.
Longer than that. When did your teeth come out?
4 years.
4 years ago, something like that. And lost a lot of bone. There's very little bone up there. And we tried to put some mini implants in, but it just wasn't holding because he had so much bone loss, and his sinuses are very close. And so what we're going to do is we're going to do some onlay bone grafting, and we're going to use the new Shatkin First Restore Plus bone graft material. This is a pure collagen, pure bovine collagen. And we're going to be making a flap, and we're working mostly in the posterior on the upper right and left side. We're going to do some onlay bone grafting. We're going to be reflecting the periosteum, and we're going to be placing this bone under the periosteum. We're going to suture that together, and we're going to give it about 3 months for bone healing. And then we're going to go back and try to replace the implants and get some stabilization. So this is the new Restore Plus by Shatkin First. This is a great product. If you haven't used it yet, you got to try it. It's half the cost of the products that we've used in the past. And it's an excellent product for bone grafting and for filling sockets, for healing sockets, for preserving sockets. And in this case, we're going to use it as an onlay bone graft material. These are bone plugs, just like you're familiar with. And what we're going to do is we're just going to flatten it, and we're going to lay it under the periosteum in both sides. I'll probably use at least 2 on each side. All right, so again, we're going to be doing a onlay bone grafting procedure to build up the posterior of David's maxilla. He's already been anesthetized. Is that better?
Mm-hmm. Much better.
All right, we're going to make an incision here. You feel anything, Dave? Okay. So it's very, very thin bone. It's very thin. There's really very little. But the important thing is you've got to reflect the periosteum. So you've got to get down, all the way down to the bone level, and reflect the periosteum. Keep in mind that his sinus is really, really close there, so you got to be gentle in the reflection of the periosteum. But here's the periosteum. We're just going to reflect that periosteum all the way down to the bone, because if you don't reflect the periosteum, you're not going to get the bone fill that we're looking for. And here's a sinus right there. You can see it. We're right into the sinus right there. So that's very important. We're going to try to augment that. He feels that a little. Okay, we'll give him a little more. Sorry, Dave. We'll numb you a little bit more. You feel this? You okay? I'm just numbing you some more, okay? Still feel it? Feel that? You should be better now. I'm sorry about that. Let's see. Okay, so we've got a little window flap there. Turn that way just a little bit, okay? I'm going to use this Minnesota retractor here. We're going to retract that. So this is right here is sinus. You see that, right? John? Okay. John's my cameraman, so I'm going to clean this out a little bit here. This may have been some granulation tissue from the previous implant hair suction here. Right here is sinus cavity here. Have a curette, please. That's where a previous implant had failed. But he actually has some bone here, which is good. Back here, there's not a lot, but we're going to work on it. So here's the sinus. We're going to put the bone graft right over that, and we're going to fill that hole. Okay, can you open me a graft, please?
Yep.
Restore Plus. Okay, so here's a Restore Plus bone graft material. And what I'm going to do is I'm going to plug it into the hole right here. I'm also going to, can I have a plugger? Don't be stingy with the material. This is very reasonably priced material. You can use as much as you need. We cleaned out that socket. We're going to plug it completely in that hole. Okay, and now I want to do a sinus lift a sinus bump in this area where we have a sinus opening. Break that in half for me. Okay, just hold it. Pull it.
It won't rip.
Okay. No, I don't need that. I'm just going to plug the hole there that's in the sinus. Okay, there we go. Now I'm going to take another piece of the graft material. I'm going to do an onlay graft because if you look here, it's very thin. You can see the bone is flexing there. That's right where the sinus is. So now we're going to lay this right on top. Just like that. We're going to do an onlay bone graft. Just like that, okay? And I'll take some sutures. And we're going to suture that. Just like that. Again, the most important aspect of this entire procedure is to elevate the periosteum. So you got to go right down to bone level because the periosteum will generate bone. By just making that little bit of space and doing the onlay graft, you'll generate bone. So now we're going to put a suture here. Hold this here. It's not a difficult procedure to learn how to do. Okay, now we're going to do I'm going to do a running suture. So I'm just going to get this all put back together. It's like a baseball stitch. dab that with a cotton. Dry it with a cotton. Okay, and one more suture here. Hold the lip way up here. Let me get that. Okay. And then we'll tie this. Thank you, Sonny. Okay, that's fine. We can cut that. No, not too short. Not too short. Okay, right there. Okay. All right. All right. So that side's done, and we'll go ahead and do the other side as well. There's one more little suture I want to put here on the distal releasing incision. Let's close that up as well. Where does it go? Just one little interrupted here. Cut it. Sonny. Cut it. Is Jared doing okay with it? I'm going to do the same thing on the other side now. And again, we're going to elevate right down to the periosteum. Right beyond, you want to get right down to the bone. In other words, you want to reflect the periosteum. It's a full thickness flap. You don't want to have a partial thickness flap. So you got to go all the way down to the bone, reflect that periosteum. And there's the bone. Turn toward me a little, Dave. Okay. Bone's in a little better shape on this side. I'm sorry. You okay? Okay. There we are. All right. Hold this for me. I'll take another bone. Okay. So we're using the Restore Plus by Shatkin First Pure Bovine plug. We're going to lay that in there. This side doesn't have any socket, so we don't need to plug a socket here. We're just going to lay this underneath the periosteum. Okay, let's put it on there. Okay, let that go. Okay. That's it. Now we'll take a suture. Oh, a suture, is it gone? Yeah, we should be okay. Hold the lip up right here. I think I'm going to need another suture, Sonny. It's a little short. Let's see, maybe I can make it work. My dad never let me waste any suture. Okay, we made it work, Dad. You'd be proud of me. Okay, cut that. Not too short. Oh, okay, here. Get this one. Okay. All right, we got that all set. Now, just gonna put a little denture glue in here. All right, I'm putting a little denture glue in your denture, Dave, and that's it. And we'll let that heal for a good 6 to 8 weeks at least. Probably 3 months is better, okay?
Thank you, doctor.
Yeah. All right. So we've successfully done a bilateral maxillary bone graft, onlay bone graft to build up the ridge. On the right side, we did a little bit of a sinus bump because we had a sinus opening. We plugged that hole, pushed it up a little bit, and we'll give it time to heal, and we'll take a post-op x-ray in about 2 or 3 months. We'll see how the bone's looking, but I suspect this will work out really well, and we'll be able to place some mini implants in about 4 or 5 months. Thanks for joining me on the Monday Morning Minute, and we'll see you next time. Good morning and welcome to the Monday Morning Minute. You just saw me do a live surgery demonstration where we used the Restore Plus bone graft material. This is pure bovine collagen bone material. And they're bone plugs and they're wonderful. And you saw me use them. They work very, very well to help fill bone sockets. They can be used for onlay bone grafting like you saw me use just now. They can be used for wound healing dressings, but they work really fantastic in extraction sites to plug the hole and help the bone regenerate. It's a regenerative bone material and it works fantastic. It helps form a clot for regenerative bone to fill in. And you will see tremendous results with this over the course of time. My advice is for everybody to use the Restore Plus Bone Collagen Plug on all of your extraction areas. It's a phenomenal product, brand new by Shatkin First, manufactured exclusively for us in Israel. It's a great product, and it's going to be fantastic for your office and for your patients. And we're running an amazing special on this. This product is less than half the cost of Osteogen.
And the doctors who have bought it so far, they absolutely love it. Because they're
we
telling
sold out
Lenny
the first batch completely.
Yeah, that's
and
gone.
We're getting
So
more product in as we speak. We're going to have an unlimited amount of this product available to you. But this is an amazing product, and you need to take advantage of this. You're going to love it. You're going to use it all day in your office, and the patients are going to benefit from getting the bone grafting they need for their cases.
Can I reiterate the special one more time? So if you buy 3 boxes of either the 5-pack or the 10-pack, you get the 4th box free.
Wait a minute.
So
3?
Yeah, 3.
They buy 3 and they get the 4th free?
That's right.
Fitz, are you sure you want to give such a good deal? They're already getting a great deal at less than
half the price, right?
Less than half the cost of Osteogen. Now you're throwing in a 4th box free?
4th box free.
They're taking another 25% off the price.
That's it.
You didn't even ask me about this, Fitz.
Hey, we got to help our docs.
You got to help them
Remember
out.
what you always say.
You got to ask me. You always told me something. I'm not going to repeat it.
You better not.
But, all right, we're going to give them the 4th box free if they buy 3 boxes. And these come in 5-pack or 10-pack.
Correct.
So they can buy a 5-pack or a 10-pack, and they can buy 3 boxes of 5 and get the 4th box of 5 free.
Correct.
Or they can buy 3 boxes of 10 and get the 4th box of 10 free.
Right.
All right.
Yep. Lenny, William, Joey, and I, we think it's a great deal.
Don't give them a free 10 box if they only buy the 5 packs.
We won't do that. We won't do that. You have to. We're gonna count. We're gonna count the plugs before they leave.
We're already
okay.
discounting this a lot. But this is a great new product by Shatkin First. We're very excited about it. I'm using it all day long in my office, and you should too. But there's something else, Fitz.
Yeah.
Somebody told me that they're throwing a 60th birthday party for me.
You bet they are.
Are you involved in that?
A little bit. Yeah. We're gonna have quite a shindig on the 7th of June.
I hear we're going to have about 100 people at my backyard at my house.
That's right. We're going to have. And what are you doing?
You're doing
and
my sister and Mark put this whole thing together and didn't even tell me about it. But
it was supposed to be a surprise.
I remember my 50th birthday surprise party, and a lot of you are still working with us that came to that 10 years ago. Please come and join us for this really great celebration. I'm very excited to welcome all of you to our course here June 5th, 6th, and 7th. Now, Fitz, I know my brother is doing something special for my birthday also. He's going to do a half-day Botox course at no charge.
That's correct. And, you know, we got a couple more sign-ups this morning. So if you're interested in doing the hands-on portion, so
there will be a charge for the hands-on.
There will be, but he's given a great deal.
The course itself, the didactic, is going to be at no charge.
Correct. The didactic.
So you can come. We've never done that before with my brother.
It's really good.
Sam, I want to thank you very much for doing this for my birthday. It's going to be a half a day on Saturday, June 7th in the morning from 8 until noon. We're going to have the didactic course and the hands-on. If you sign up for the hands-on, you can do the hands-on injections on one of your staff members or on a volunteer patient.
Yeah, your brother said that there are going to be plenty of live patients to work on, and he wants you to get the feeling of how to inject it. And I've been to many courses with Sam.
We'll be teaching you Botox injections for the masseters to stop people from grinding their teeth. We'll help you to prevent clenching and grinding. You'll be able to do Botox for cosmetic purposes and all the face, and you'll be certified by the Aesthetic Learning Academy, which is my brother's Botox Academy. You'll get certification so that you can go out and provide Botox in your communities for your patients. And it's great. That program is at no charge for the didactic, but if you want to get the hands-on certification, you'll sign up for that.
And usually it's $14.95. He's only charging $7.95.
Oh, it's half price.
So it's half price, right? And he's really
Fitz. Everything's half price today. This is half the cost of the Osteogen. The Botox hands-on is half the cost.
That's right. Yeah.
What are we doing for our course the 5th, 6th, and 7th?
So the 5th, 6th, and 7th. On Thursday and Friday, you're going to be doing some live surgery, from what I understand.
Absolutely.
I saw the schedule.
Yeah.
And we're also going to have Dr. Thomas Baggett. He's going to be lecturing with us. Randy Staples is coming up from Tennessee with his entire family.
Can we offer the 3-day training program at half cost for my holiday week, for my birthday weekend?
Why don't we call this 50% off Monday Morning Minute Special, okay?
Can we do 50% off for anybody who comes to the course?
Let's do it, yeah.
So what's the cost going to be for the course?
So usually it's $9.95, so it'll be $4.95 for 2 days and 16 CE credits.
No, it's actually 3 days because they can stay for my brothers at no charge,
That's right. They can
stay
for 3.
The 2 days, the 2.5 days for half price, basically $4.95. It's a freaking bargain.
It is a good deal.
How can they pass that up?
That's a good deal. And that's quite a few CE hours too. So it's very inexpensive CE. And where can you get inexpensive CE?
How many hours
a great
of CE
barbecue,
will they get?
Great education.
How many CE hours will they get for the 2.5 days?
They could get upwards
60.
of like 20, 24.
They're going to get 20 hours.
Yeah,
no, 20 hours.
20 hours. Oh, that's right, because we're stopping early on
You'll
Saturday.
get 20 hours of CE for $4.95, and that's something that you just can't find elsewhere.
Pretty good deal. Yeah.
Come join us, please. And then after the course on Saturday, we're going to shuttle you over to my house, and we're going to have a tremendous barbecue, swimming party. Bring your bathing suits.
Yep.
Be ready to have fun. It's going to be a beautiful day because it's never rained once on my birthday. I promise the weather will be perfect.
And the weather's beautiful in Buffalo in June, which I know some of you struggle through the December, January, and February months, but come in June, you'll love it. Bright blue skies and sunshine.
We look forward to seeing you June 5th, 6th, and 7th.
Have a great week placing minis and monos. Join Dr. Thomas Baggett, Dr. Randy Staples, and of course the birthday boy himself, Dr. Todd Shatkin. And they will be sharing their over a century of implant experience with all attendees at our course. And then on Friday afternoon, Dr. Samuel Shatkin will be giving a lecture on Botox and dentistry and how to save those restorations that you work so hard on. On Saturday, Dr. Samuel Shatkin will be doing a hands-on Botox lecture. The course will go from 8 a.m. till noon. Anyone who's interested in learning to do Botox hands-on with live patients, this is your course. Sign up today for this exciting advanced course in Buffalo. Join us on June 7th to celebrate a major milestone, Dr. Todd Shatkin's 60th birthday party. We're hosting a backyard barbecue and a pool party at his home, and you're invited. The day kicks off with continuing education, so come learn, connect, and grow. Then stay for the food, friends, and fun as we honor Dr. Shatkin's incredible legacy. It's a celebration you won't want to miss and a memory we'll make together. RSVP today, and we look forward to seeing you there.